Trips to the dentist can be accompanied by fear, anxiety, and in some cases, big dental bills. But one Sacramento area dentist is treating her patients with a lower cost alternative that can also help solve many dental issues. Dr. Andrea Joy Smith has seen the confidence many dental implants have given her patients, and she says it's done with less pain and at a lower cost than a full set of dentures. She's with us now to explain how it all works. Great to have you back on the show, Dr. Smith.
Thank you so much for having me, Aubrey. It is so great to be here as usual.
Yeah, so tell us about these mini dental implants and a common way that you use them.
Mini dental implants are a way of replacing teeth, and one of the most common ways that we use them is that we stabilize patients that wear dentures. Oftentimes, patients that wear dentures complain of loose and slipping dentures, and so our mini dental implants can help them do away with the dental adhesives, and they can actually taste their food better too because we can remove a large part of the palate.
And we have a video of a gentleman that received the implant procedure at your office. Let's go ahead and take a look.
It's amazing. I'm so happy to be able to chew, to smile with confidence, and above all things, once again, chew peanuts and gum without having to worry about anything falling apart.
Well, he certainly seems happy with his results. Doctor, tell me, how long have you been placing mini dental implants in your patients?
I've been placing mini dental implants since about 2007. And that particular patient, he was only missing a few teeth, but it made a whole difference in whether or not he could chew his food properly, whether he can chew gum, which he's always allowed. And so this last 12, 13 years of placing mini dental implants have really been able to help patients just like him.
And as we mentioned at the top of the segment, the cost is a little bit different with the mini dental implants versus a full set of the traditional dentures you might think of. So talk about the cost difference.
The cost difference is really substantial. The one of the reasons that makes the cost difference is the design of the implant and the actual minimal surgical procedure. So conventional implantology, I cannot say exactly how much of a price difference there would be without doing a consultation, but you will find them to be at least half the cost of traditional implantology. And so when patients have a minimal amount of bone and sometimes finances are an issue, those patients can be helped by mini dental implants because we do not require the larger amount of bone, and also the finances can save them about 50%.
And that's so true because cost can be something that stops people from coming in and getting their problems fixed. Also, they might be a little scared, a little bit anxious about visiting the dentist. Talk about what sets your office apart when we're talking about some of the implant services that you offer.
Absolutely. The fear and the anxiety is definitely real. A lot of these patients that have been suffering from problems that require the use of implants, they've avoided the dentist for years, most of the times due to fear. My office does offer sedation dentistry. So whenever I need to do, especially a full mouth replacement or even stabilize a lower denture, one of the comforting things that we offer at our office is sedation dentistry. And we encourage those patients to come in, at least have a consultation, find out if they're a candidate, and we have the tools and the services at our office to deliver that care when they are 100% comfortable.
And it's great that you mentioned options because people do love their options. Let's take a look at some more before and after photos, and you can kind of tell us a little bit about each of these patients.
Yeah, when I see these photos, it's been a while since I've seen some of them. They all have a very similar story. I've stayed away from the dentist for years. When I go to the dentist, I feel embarrassed. And so I'm looking for a solution that's going to solve my problem of not being able to eat and also solve the embarrassment problem. So this patient, some of the patients you're looking at have put off very important life events like marriage, public speaking, and things of that nature. And just being able to provide them with the smiles that they need to pursue their life goals and careers has been extremely rewarding for me.
And Dr. Smith, what is the average timeline? I mean, we looked at some of those before and afters. I mean, it's a huge difference. Is it a long time from start to finish?
Often, no, several months. What happens is when the patient comes in for a consultation and they begin treatment, We take an impression of the mouth the way that it is. We then have our lab fabricate a full set of nice looking temporaries. And on the day they come in for treatment, we take out all the teeth that's necessary. We put in all of the implants that's necessary, and they leave with those nice permanent teeth, or I'm sorry, temporary teeth. And those temporary teeth are there for about 3 to 4 months while all of the healing and shrinkage takes place. And then we start the process of trying in the final product. So within 6 months, we can go from start to finish. But certainly within that first office visit or the second office visit, we can have them in a nice set of teeth that they're very proud of.
Yeah, after they've maybe gone through a large part of their lives with not being satisfied, 6 months doesn't seem like too long to wait. Dr. Smith, thanks so much for joining us this morning and sharing what your services are. To connect with Dr. Smith and find out more about mini dental implants, visit smileagainnow.com.
This interview involves commercial content. The products and services featured appear as paid advertising.